Appreciate you being with us. Now, on Monday, the Supreme Court hears the challenge to Obamacare. Republicans want it overturned. But even if that does happen, I'm saying it will cause chaos in Congress. Lawmakers can't even agree on a budget, let alone redoing the mandate in Obamacare. So let's bring in Republican Congressman Kevin Brady of Texas, joining us from Houston. Congressman, thanks for joining us. I know you just heard what I said there. Let's suppose that the mandate is thrown out. The Supreme Court says, no, you can't do that mandate. It's going to be chaos, isn't it?
Look, it'll be much better than allowing this health care bill to go forward. I think the reason the president on the second anniversary is running from this bill is it's more unpopular today than it was 2 years ago.
But what are you going to do?
Almost every pledge from the deficit and all that has proven to be untrue. And what we could have, what we will have when it's struck down, is what we should have had, which is a real discussion about how we reform health care and make it more affordable. And we didn't, Stuart. As you know, one party in back rooms made this happen. So we'll finally have the debate of ideas.
Yes, I know
we never
will.
had.
But you're not going to have that debate for a long, long time to come. If it's struck down in June, you cannot have some new law put in its place before November. Congressman, that's not going to happen. You're going to have to wait until the Congress reconvenes in January, and then you're going to debate it. Well, in the meantime, you've got chaos, haven't you?
Well, the good news is for Republicans, we've got a plan ready that actually focuses on lower health care costs. I think if hopefully when the Supreme Court strikes it down, we'll have a chance to put those ideas forward in the House. We're ready to go. Now, we do need the Senate to actually sit down with us and work through a bill, but I will tell you, there isn't a rush to get it done by November. What we're seeing now is a rush to push this bill into place, the current law into place, and that's why we're seeing all the bad news on its cost, on its price, on how many million Americans will be forced out of their own health care.
I guess a lot of people just wonder, okay, you've got a plan, you're going to put it forward, but it's not going to be passed until way into next year, and a lot of people are real worried. What do we see between now and early next year if this mandate is thrown out? I mean, I keep returning to the word chaos, and I don't think you'll disagree with me, sir.
Well, Stuart, yeah, I do disagree, and I rarely do, by the way, which is why I love coming on the show. You always challenge me, and I appreciate that. But I'll tell you, the real chaos I'm seeing is back home here in Texas. Small businesses, mid-sized businesses, large businesses are very worried about this measure, the current one in place. They're concerned about what it will do to drive up prices. Many of them are planning to drop their plans and move their workers to the exchanges because they'll have no choice. And the healthcare community is in a bit of a chaos right now.
I agree with that.
Because of the uncertainty about the new bill being put in place.
Congressman,
so
I think that's a fair point.
This might create some help.
I think that's a fair point because there is chaos at the ground floor level with healthcare as of right now. And I'm not going to retreat from the word, and you're right, we've got it right now. Congressman, always a pleasure. Thanks for joining us, sir. We'll be watching and listening to those oral arguments next week. Thanks very much, Congressman.